Have you ever stopped to think about why semen tastes the way it does, or if there's any way to improve its flavor? Many people are curious about this topic. I'm Dr. Rena, a urologist and pelvic surgeon, and today I'll explain exactly why semen has the taste it does, whether it can actually be changed, and what factors might influence it. If you're new here, I create educational content about urologic health, sexual health, bladder wellness, and much more. So be sure to subscribe and let your friends know about the channel as well. When semen, or ejaculate, is released, many people assume it's made entirely of sperm. But that's not really the case. Sperm actually makes up only about 5 to 10% of the total volume of semen. Semen contains several different components, including fructose, which is a natural sugar, as well as minerals such as sodium, zinc, calcium, citric acid, and phosphorus. It also has a naturally alkaline nature. So what does alkaline mean? On the acid-base scale, where 7 is considered neutral, semen usually falls between a pH of about 7.2 and 8.2. There's a reason for this. For reproductive purposes, the vagina normally has an acidic environment. In order for sperm to remain healthy and survive in that setting, the fluid surrounding the sperm is alkaline, which helps protect them. Because semen is alkaline, it often has a slightly bitter taste. At the same time, the fructose can give it a mild sweetness, and the mix of vitamins and minerals may create a faint metallic flavor. That leads to a question many people ask. Can eating certain foods, like pineapple or other fruits, actually make semen taste sweeter? It's a very common claim people talk about, but does it really hold up? The truth is, there hasn't been a proper scientific study on this specific topic. Researchers haven't conducted a controlled experiment where one group eats pineapple and another avoids it, just to compare how it might affect the taste of semen. So I can't say with scientific proof that this idea has been formally studied and confirmed. However, it does make sense that eating fruits with a higher natural sugar content, like pineapple, kiwi, peaches, or oranges, could slightly raise the fructose levels in semen and make the flavor a bit sweeter. It's not going to turn extremely sweet, but it may become somewhat milder. Pineapple often gets mentioned the most because it's acidic, which may help lower the pH of semen a little. When the pH drops slightly, the semen becomes less alkaline and therefore a bit less bitter. Other fruits with similar acidic qualities include lemons and cranberries, which can also contribute to balancing pH levels because of their natural acidity. Certain spices such as cinnamon, nutmeg, and even wheatgrass have also been suggested to help improve or sweeten the taste. Celery, which is high in vitamin C, may help reduce some of the salty flavor and make the taste a bit milder as well. Drinking more water can also make a difference, because better hydration can dilute semen slightly, making the overall taste less strong. So does that mean you should eat a bunch of pineapple right before intimacy or oral sex? Not really. These changes don't happen instantly. If you enjoy fruits and foods like cinnamon, nutmeg, or celery, it's perfectly fine to include them as part of your regular diet. Just remember that some fruits contain high amounts of sugar, and eating them in very large quantities may not be the best choice for your overall health. It's also important to know that certain foods can make semen taste less pleasant. Similar to things that can change the smell of your urine, like asparagus. Asparagus may cause semen to smell or taste somewhat unpleasant. Other items like coffee, marijuana, alcohol, and even large amounts of red meat can give semen a stronger, saltier flavor. The bottom line is this. For many reasons, including sexual health, semen quality, testosterone levels, and heart health, it's important for men to maintain a healthy diet. Eating well can support stronger erections, better tasting semen, healthier testosterone levels, and overall well-being. A good diet generally means including plenty of fruits and vegetables, cutting back on processed foods, and limiting items that come in packages, since they often contain high amounts of salt and additives. It also helps to avoid fried, greasy foods and excessive red meat, which can contribute to clogged arteries. All right. I hope that clears things up for you. I look forward to seeing you again next time. And as always, remember to take care of yourself, because you truly deserve it.